I don't know yet. I'm looking into this deeply with other companies and some of the companies I consult. I don't know if it's a percentage over time that crushes you and puts you on the red line, or if it's a whole number. If there's just a number of surgeons or customers that crush your revenue ramp. I don't know yet. I don't know if it's a percentage over time or it's just a sheer number that you reach, but this is happening to a number of customers, and maybe you're seeing it yourself. Or when you go look at your customer base, you see 20, 30% of your customers have tried your product, but they've put it back down. So please understand, I have a deep respect for this endeavor that we're all on of trying to introduce life-changing technologies or game-changing technologies. But changing human behavior is tough in and of itself. Changing or persuading another person who's your superior in almost every way, which is true of MedTech and biotech salespeople who are going out into the field calling on specialists who tend to be their superior in education. They carry more prestige, they make more money, they've got more letters behind their name. That's a challenge. Convincing a physician to put a new innovation in or on another human being who's been entrusted to their care, to go against years of training, years of practice with another technology or another procedure, to go outside the guidelines of their specialty, and maybe do all of that with a very real risk that they're not going to get paid because you have a code but you don't have coverage. That's a monumental task. So what drives us? What are we doing here? Well, a day at work for us in MedTech is a life event for a patient. That's what's driving us. And for most of you, you do have a personal connection to this technology because of somebody in your home, or maybe a loved one who's affected this way. So I get it. Everybody knows they have to get a code, and you guys are working with consultants to help you navigate the reimbursement landscape. But this is interesting. One of my clients, Intrinsic Therapeutics, when they were creating the Barricade device for herniated discs, they actually went to CMS while they were designing their clinical trials. Now that's a super good idea, right? And they got input from CMS about how to design their clinical trials. If your product is going to impact Medicare patients, you should talk to CMS. That's great advice. And then they talk a little bit about market preference testing. Now, I personally have an instance where this happened. I was at a clearance when we launched this device, which is the Cyclops Scope. Awesome device, game changer, super good. But they got too excited by some early and initial reactions when they showed it to surgeons that they actually didn't do the work of market preference testing. And this great device could have been awesome, but it's now on eBay. Oh, and listen, great device, awesome engineering, awesome R&D. It was a commercial failure. Bad targeting, not enough market preference testing.
Success requires insights. Elite execution requires training. Go to www.exsalesconsulting.com/special offers.